Gentlemen, let's have an honest conversation about something nearly every man past 50 has quietly worried about, but almost nobody talks about out loud. What actually happens inside your body when you go weeks, months, or even years without any sexual activity. Maybe you've been on your own for a while. Maybe a health condition changed everything. Or maybe life just got busy and intimacy slowly faded into the background. Whatever your situation, I'm willing to bet you've heard that old saying, use it or lose it, and it's been sitting in the back of your mind ever since. I'm Dr. Emily Carter, a board-certified urologist with over 12 years of clinical experience. And today, I'm going to give you the real, science-backed truth about what happens down there when you're not using it. And here's what might surprise you. A lot of what you've been told is wildly overblown, but there are some genuine changes that do occur, and you need to know about them. Stick with me until the end, because I'm going to tell you exactly what's a myth, what's a fact, and most importantly, what you can do right now to protect your health and your manhood, whether you're having regular sex or not. Let's start by smashing the two biggest myths I hear from patients in my clinic almost every single week. Myth number one, if you don't use it, it completely shuts down forever. Here's the reality. Your body doesn't just flip the off switch because you haven't been intimate in a while. You're not going to wake up one morning and discover that everything downstairs has permanently gone offline. Your tissues, your nerves, your entire hormonal system, they are incredibly tough and resilient. Myth number two, if I go months without sex, my desire will vanish and never come back. Also completely false. Sure, hormones and your mental state play a part, but a break from sex doesn't sentence you to a lifetime without desire. Your body is designed to adapt, and that drive absolutely can and does come back when the right conditions return. Now here's where it gets important. There are some real, measurable shifts that can happen in your body during long stretches without sexual activity. These shifts aren't devastating, but they are worth understanding so you can take easy, smart steps to stay ahead of them. Let me break down the science for you in plain, simple language. No confusing medical terms. Your whole reproductive and urinary system runs on three essential things: blood flow, muscle strength, and hormone levels. Picture these as three legs of a stool. If all three are solid, everything stays balanced and strong. When you have regular sexual activity, whether that's with a partner or on your own, you're basically performing routine maintenance on all three legs. Sexual arousal sends a rush of blood to the pelvic area. That extra circulation feeds the tissues, keeps them healthy, stretchy, and full of life. Think of it like giving water to a garden. The tissues stay soft and ready to respond. When you climax, your pelvic floor muscles squeeze and release in a rhythmic pattern. Those contractions are like a built-in gym session for those muscles, keeping them firm and strong. And strong pelvic floor muscles aren't just important for sex. They also control your bladder and support your core. And then there's the hormone connection. Sexual activity works with your hormones in powerful ways. Testosterone, the most important male hormone, drives your desire, your energy, and even your mood. Staying active keeps those hormonal pathways fired up and responsive. Now, I can already hear some of you saying, all right, Dr. Carter, so what exactly changes if I'm not active? That's precisely what I'm about to walk you through. But first, quick favor. If this is making sense so far, tap that like button right now. Subscribe to the channel so you catch every new video on men's health. And drop a comment below. Tell me what country you're watching from. I genuinely love seeing men from all over the world stepping up and taking control of their health. All right. Let's dig into the four most common changes men go through during extended periods without sexual activity. Change number one, blood flow and tissue health. The science. Your penile tissue is made up of something called smooth muscle. This tissue depends on a regular supply of oxygen-rich blood to stay healthy and flexible. When you get an erection, blood floods into the tissue, stretching it out and keeping it limber. When you go for long periods without erections, and that includes those nighttime erections your body produces automatically as its own natural maintenance system, the tissue can gradually lose some of its stretch and spring. Think of it like a brand new rubber band that's been sitting in a drawer for months. It still works, but when you first pull it, it feels a little tighter and stiffer than it used to. What you'll actually notice. Some men find that after a long break, their erections feel a bit softer at first, or it takes a little more time to reach full firmness. The encouraging part? This is almost always temporary. Once activity picks back up, blood flow returns and the tissue bounces back to its normal responsiveness. The emotional side. This can be genuinely frightening the first time you experience it. Your mind races and you think something is permanently damaged. But knowing that this is a natural, reversible response to a period of rest can take an enormous amount of worry off your shoulders. Change number 2, pelvic floor muscle tone. The science. Your pelvic floor muscles, the ones that manage urination, hold up your bladder, and play a key role in erections and orgasm, thrive on regular contractions. Every time you climax, those muscles fire in a rhythmic sequence that essentially keeps them in shape. What you'll actually notice. When you go through a long period without sexual activity, you might pick up on small differences in bladder control. Perhaps there's a sudden urgency you never had before, or maybe a tiny bit of leakage when you sneeze, cough, or shift positions quickly. Change number 3, testosterone and hormonal balance. The science. Testosterone levels naturally drop as you get older. That's just biology. But regular sexual activity seems to help keep the entire hormonal machinery engaged and humming along. Some studies suggest that men who stay sexually active tend to hold on to slightly healthier testosterone levels, though the relationship between the two is more complicated than a simple cause and effect. What you'll actually notice during long gaps without activity. Some men start feeling less driven, less energetic, or just kind of emotionally flat. Desire can dip, and that creates a frustrating loop. Less desire means less activity, and less activity can push desire down even further. The emotional side. This one cuts deep. A lot of men tell me they start feeling less confident, less like themselves, almost like a piece of who they are is fading away. But understanding that this is largely a hormonal pattern, and one that can be treated, is incredibly powerful and reassuring. Change number 4, psychological and emotional effects. The science. Sex isn't just a physical act. It's wired directly into your mental health. Regular intimacy has been connected to lower stress, deeper sleep, and a brighter overall mood. A big reason for that is the flood of feel-good chemicals like oxytocin and endorphins that your brain releases during and after sex. What you'll actually notice. Men going through long dry spells sometimes report higher stress levels, a creeping sense of loneliness, or noticeably worse sleep. And if you're in a relationship, the absence of physical closeness can quietly build a wall of emotional distance between you and your partner. The emotional side. Honestly, for most men, this is the hardest part of all. Sex is about more than pleasure. It's about connection, closeness, and feeling wanted. When that disappears, for whatever reason, many men carry a deep, silent sense of loss that they never talk about. Now here's the single most important message I need you to take away from this entire video. For the vast majority of men, especially those in their 50s and 60s with reasonably healthy hormone levels, these changes are not permanent. Your body has an extraordinary ability to recover and adapt. When you start being sexually active again, whether with a partner or through self-pleasure, blood flow ramps back up, tissues regain their stretch, muscles rebuild their strength, and your confidence comes roaring back. However, and this is important, if you're dealing with significant age-related testosterone decline, or if you have underlying conditions like diabetes or heart disease, the effects can be more noticeable, and you might need some medical support to get things back on track. And there is absolutely nothing wrong with that. Help is available. Whether you're currently sexually active or not, here are 4 straightforward steps to keep everything in peak condition. Step 1, keep your body moving. Cardiovascular exercise pushes healthy blood flow to every part of your body, including your pelvic region. Resistance training supports testosterone production. Stretching and mobility work keeps everything loose and functional. Even a brisk 30-minute walk every single day makes a measurable difference. Step 2, do your pelvic floor exercises. You don't have to be sexually active to maintain these muscles. Basic Kegel exercises, squeezing and releasing the same muscles you'd use to stop your urine midstream, can be done sitting at your desk, riding in the car, or watching television. No one around you will have any idea. Aim for 3 sets of 10 repetitions every day. That's a solid foundation. Step 3. Consider solo activity. Even if you're not in a relationship right now, keeping your sexual system active through self-pleasure helps maintain blood flow, muscle tone, and hormonal responsiveness. There is absolutely zero shame in this. It's genuine health maintenance, plain and simple. Step 4. Get your hormones tested. If you've been dealing with ongoing low energy, fading desire, or mood swings that won't let up, ask your doctor to run a testosterone panel. If levels come back low, hormone replacement therapy could be an option that dramatically transforms how you feel and function day to day. Now, while most of these changes are perfectly normal and completely reversible, there are a few red flags that should send you straight to your doctor. Sudden, total inability to get any erection at all, even partial. Pain or sharp discomfort during erections or ejaculation. Major changes in urination, burning, blood, or severe urgency that won't stop. Or deep, persistent fatigue, depression, or any symptoms that are seriously interfering with your everyday life. And here's something critical to remember. Erectile dysfunction can actually be one of the earliest warning signs of cardiovascular disease. So if you're having ongoing problems, please don't brush them off. Your body might be trying to tell you something vital about the health of your heart and blood vessels. Before I wrap up, I want to talk about something that almost never gets discussed openly: the emotional weight of all this. So many men tie their sense of who they are, their confidence, their masculinity, their value, directly to sexual performance. So when things start to feel different down there, it can trigger powerful feelings of shame, inadequacy, or fear that life is passing them by. Let me say this as clearly as I possibly can. Your worth as a man has nothing to do with how often you have sex or how you perform. Your body is doing exactly what every human body does. It's responding to the circumstances it's been given. And with the right knowledge and sometimes a few simple changes, you can maintain strength, vitality, and function for many, many years ahead of you. If you're not sexually active right now because of things outside your control, maybe you're single, maybe your partner is dealing with their own health challenges, you have done absolutely nothing wrong. You are not failing. Life is complicated. What truly matters is that you look after your overall health and arm yourself with the right information. So the bottom line is, use it or lose it actually true? The honest answer is no, not in the terrifying, permanent way that most men fear. Your body is tougher, smarter, and far more forgiving than you've been led to believe. Take care of it, stay informed, stay active in whatever way works for your life, and you'll be just fine. If this video gave you some peace of mind or taught you something new, smash that like button right now. Drop a comment below and let me know. Which of the 4 changes surprised you most? And make sure you're subscribed so you never miss a new video packed with honest, science-backed guidance for men over 50. I'm Dr. Emily Carter. Whatever stage of life you're in, your body still has so much to give. Take care of it, and it will take care of you. Stay strong, gentlemen.